insertion should be done well. If you have to choose only 1 year to implant, so for example, both your ears are cochlear implant candidates, but you have only limited funds or opportunities to do on implant on 1 year, so then you can choose the year with the shortest duration of deafness, the more residual hearing, depending on the hand preference. So if they're a right-handed person, you can do the right hand or the right ear so that it's easier for them to manage the device. Decide based on the CT MRI, which is more surgically suitable for implantation. And sometimes it depends on the occupation. So if, for example, they're a driver, which side of the taxi do they sit in? Which side does the customer sit? That's the more important year for them to implant. We all know this, that the earlier we implant, the better. When you implant later, for example, here after 7 or 8 years, there is very, very variable outcomes, and it pretty much depends on this pre-implant time. So if it is a progressive loss and they have used hearing aid and they have benefited from it, then it's totally okay to implant at this age if they have good benefit from it and have developed some spoken language. However, if they have not used any hearing device and are on total communication, I wouldn't say no to anyone because it's up to them, but you really need to set realistic expectations if they're getting an implant at this age, that they will get very limited benefits. An important study which is ongoing, which is called the Loki study by Teresa Ching in the NAL laboratories, has really found after a 5-year follow-up on outcomes that even delaying the age of implantation by 6 months. So here you see the x-axis is the age of switch on and the y-axis is the global language score. Even moving from 6 months of switch on to doing a switch on at 12 months, there has been a drop in the language score and the outcomes after 5 years. So we see that every 6 months is very, very critical in determining the overall outcomes of language scores. So when you're doing the counseling, it's important to set the expectations on how the implant works, the CI process, the whole journey which I explained to you, from the assessment to the surgery, to the switch on, to the programming and the continuous rehab required, the continuous maintenance of the external parts which is required. We discuss the expectations. It's important to discuss about bimodal usage if they need. So it's not that if they use a hearing aid on one side, it means that they don't need to wear, if they use a cochlear implant on one side, that they don't need to wear the hearing aid. Sometimes we see that counseling as well, which should be avoided. If they can wear a hearing aid on the other side, please do, so that they continue to have bimodal usage. If they're a candidate for bilateral, please try to get simultaneous bilateral implantation because it has much more significant benefits than sequential. It's important to see that the family has a support structure to manage the situation. And it's very important if they can meet a recipient advocate who can actually share their experience about their cochlear implant journey. This really motivates them. Now, I understand we have just a few minutes left, so I'll quickly take you just to understand in basics about the implant portfolio. So in general, you will see 2 main implants which are available in the market, the Profile series implant and the Freedom implant. Here you can just see, for your understanding, the parts of an implant. This is the main receiver stimulator, which has the electronics going on. You see there is a magnet here, which is always removable with Cochlear, so that if they ever need to do an MRI of the brain, this magnet can be removed so that there is no shadow created. This part here is the electrode array, and this is the part which actually goes into the cochlea. So this whole thing is called an implant, and this part is what we call the electrode. So with the Profile series, it has a reliability of 99.82% in 5 years. And with this implant, the Freedom series, it has a 99% reliability in 14 years. So the families who are really worried about the device they're getting in, you can really assure them that the internal implant is made very robust and reliable to ensure them a lifetime of comfort and peace of mind. It's the external processor, which needs to be replaced as and when required. Now, the newest implant series which you see is the Profile Plus series implant. And the main difference here is this magnet is also compatible for a 3 Tesla MRI. So you see that's the only difference in this implant. Otherwise, it continues to have the reliability of the profile series because it's based on the same platform, and it is the thinnest implant in the world over here because it's just 3.9 millimeters. So it's really hardly visible under the skin as well. Now looking into the electrode, I'll quickly go through this. The main important thing is to have a choice of different electrodes to choose from to ensure it gives the best hearing performance, to mainly stimulate the hearing zone, which is the spiral ganglion, to preserve the residual hearing while we are inserting the electrode, and to have a continuous improvements in each electrode option. So the electrodes you choose generally depend on the kind of audiogram you have, whether it's a traditional CI candidate, whether it's a hybrid, or sometimes you have special considerations based on case-to-case basis, like common cavity or Mondini. So you see here that there are different types of electrode array available. I won't go into the details, but it's just for you to know that there is a decision which you need to take depending on the anatomy, depending on the surgical preference, depending on the audiogram of the child. When you look at processors as well, there is a variety of processors, and every few years there's a newer processor generation which comes out with much more innovative technology. And it's important for you to counsel the family to tell them about all these features before they make a decision. So now in summary, it's important to understand that this is the process which we undergo in making a decision for a cochlear implant, and each of these steps need to be explained to the family before undergoing this process. Rehabilitation is again very much important right from the start and even post the surgery. And this is one of the most important factors. I've heard even surgeons say sometimes that the rehabilitation is the most important factor which determines the outcome. And to support with this, there are also rehabilitation support features which are available on our processors. So for example, there is data logging, which tells you how much time the